Yes, sir. They are going to flash.
Recording in progress.
3, 2, 1. Good to go, ma'am.
Good evening, everybody. It gives me immense pleasure to welcome you all to Fever Quiz, organized by Fever Foundation of India. Uh, just before we start the quiz, I would like to give a very brief about Fever Foundation and its activity. Then we will be going on to run the quiz. Fever Foundation is an independent, non-commercial foundation which is supporting the educational and academic activities to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain programs and to make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. Coming on to the vision of Fever Foundation, the vision of Fever Foundation is to strive towards imparting knowledge on the unmet needs and to provide information on research, education, and therapy updates on fever management. The activity of Fever Foundation includes annual fever conference. We conduct every year in November fever conference where across the specialty attend this conference, all the specialty who manage fever, which includes pediatricians, physicians, infectious disease specialists, critical care specialists, even microbiologists. So all the specialties who manage fever come under one roof and discuss about the challenges of various issues on the management of fever. We throughout the year we conduct fever CMEs for pediatricians as well as physicians and also general practitioner. We bring about book on fever management every year. We bring about two books for fever management, one for pediatrician and one for physician. More than 10 books have already been brought in. In fact, 13 books have been brought in now. Then a clinical and epidemiological research. We do original research. The first research has already been begun. Then challenging case presentation competition for postgraduates, young scholar awards, patient education, paramedical education, public awareness activity, including the parents' education activity. This year, we did something different, newer activities, which include we started the Fever Week between 24th and 30th May. It's the first time in India and first time, in fact, in the world, the Fever Week was conducted. This is to commemorate the birth anniversary of Sir Fahrenheit, who invented thermometer and Fahrenheit scale. And during that entire week, we had several scientific activity. One is national panel discussion on errors of management of fever. For pediatrician, it was on 24th May. It was a mega seminar. And 25th May, it was for physician. And we did more than 100 programs across India during that week on Fever Week, CMEs. And we also did parent education, patient education, public education activity through FM radio. So our advisory board members were kind enough to help us out, and they participated in the regional language educational videos through FM wave. Then we have started the fever research activity. First original research activity has been initiated at Ellen Medical College, Bhopal. And Fever Quiz is an important activity which we do before the FEFCon starts in through Fever Foundation. So first zonal quiz happens 23, 24, 25, 26. Different don'ts participates. The winner, first and second winner will come into the FEFCon, the national conference, to participate in the grand national quiz. And we have two quizzes every day for pediatrician and postgraduates at 4 o'clock and medicine postgraduate at 7 o'clock. And since the postgraduates are here, I would like to make another announcement that poster competition will also be conducted before the FEFCon. These posters will be presented and displayed at the FEFCon conference. The last date of submitting your poster is 10th September 2024, and this poster has to be related to fever. And the poster presentation competition is likely to happen on 17th or 18th of October. And we are also starting fever training manual, a certificate courses for general practitioner, family practitioner, and various aspects of fever management. So I am also inviting you, all of you, to the FEFCON 2024, which is the seventh annual National Conference of Fever Foundation of India. It's going to happen on 23 and 24th of November. Please do attend. A lot of exciting scientific sessions will be there by eminent speakers. Kindly do make it a point to attend. You will get the links through, already you have registered through this database. I am sure you will get the link. Also, it will be displayed in your respective colleges and institutes as well. So today, I once again welcome to the Fever Quiz, and our quiz host is Dr. Jagdish Chinnappa, sir. Sir is the founder member of our Fever Foundation, and also sir is the consultant cluster head pediatrics at the Manipal Group of Hospital, Bangalore, past president of Respiratory Chapter Indian Academy of Pediatrics, CEO of Doctrain LLP, is a consultant at Childcare Bangalore. So, Dr. Jagdish, sir, it's pleasure and privilege to have you with us, sir. Welcome to you, sir. We have the quiz master today, none other than Dr. Chetan Trivedi, sir. Sir is a very well-known pediatrician, senior pediatrician and ID consultant at Neha Children Hospital, Ahmedabad, ex-honorary assistant professor and infectious disease consultant at UN Mehta Institute of Cardiology and Research Center. He is a president of AOP Gujarat, organizing secretary of IPA Pedicon 23, executive board member of Gujarat CIP, a secretary of IAP ID chapter. He's a scientific convener on a special program he does. It's been doing, I think, for several years now. Wednesday Wisdom, very popular program. It's a weekly webinar series under Ahmedabad Connect. Past President AOP Ahmedabad, authored several books and published many papers. He is national trainer for many central IAP modules. Sir, Dr. Chetan Trivedi, sir, thank you very much and welcome to you, sir. We have the jury for today, quiz jury. We have eminent professor Dr. M.K. Sudarshan, sir. Sir is the ex-chairman of Karnataka State COVID-19 Technical Advisory Board, Government of Karnataka Advisory Board, Fever Foundation. Sir has also been the founder member of Fever Foundation and ex-director and retired dean, principal and professor of HOD at Community Medicine, the Premier Institute, Kempegowda Institute of Medical Sciences. Sir is also member of WHO expert committees on rabies at Geneva. Sir is known for, is also NABH Assessor and Clinical Trial and Ethics Committee, New Delhi, till date. He has several publications, several awards and accolades to his credit. He has been awarded, including the Dr. B.C. Rai Award and highest award of Karnataka Government Rajyotsava Order, Best Doctor Award during the COVID-19. His work in the COVID, the Karnataka government has recognized. And also he has been the eminent teacher award from the Rajiv Gandhi Health University. So Dr. Sudarshan, sir, it's pleasure and privilege to have you as jury, sir. Welcome, sir.
Thank you, madam.
So before we start the quiz, I would like to brief you all about the rules and regulations of this fever quiz. This quiz is for postgraduates only. The quiz consists of a multiple choice questionnaire. Will be 15 seconds to answer each question. Please note that the option to be selected by clicking on the button on the text panel. There will be video display of the question with option that is only for representation purpose. You need to click the text which is below this video or button. On the text panel, there will be four options. You need to select one of them and submit. And please, all the participants are advised not to leave the platform. Once you submit the answer, it is not possible to rebut. There is no negative marking. The winner will be on maximum fast right answer. So if in the case there is a tiebreaker round will be done and that will decide the winner. It is advisable to use your laptop and desktops. It should not use mobile phone for getting the answers from any colleague sitting nearby. And Fever Foundation is not responsible for any form of technical errors such as poor internet connectivity. Then participation in the quiz implies that the participant has accepted the integrity of these rules. The participants who have given incomplete or inaccurate personal contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and the candidature for the prize. And first and second winner from this zones will enter into national level quiz with FEFCON 2024, which is scheduled at November. And finally, the quiz master and judges' decision will be final. So thank you very much. I wish you all the best for the quiz. Now over to the quiz, my host, Dr. Jagdish sir. Over to you, sir.
Thank you very much, Dr. Manjula. I think you have outlined the rules and regulations very nicely. And please note that the most important thing is that you need to answer right and you need to answer fast. These two things are very important. Please formulate your answers as soon as the question comes onto the board so that you don't waste any time. Because we have seen that when you delay, you will lose that opportunity of getting the marks. And today's quiz master is a very eminent pediatrician from Ahmedabad, a very close friend, and he's a master at conducting quizzes. So we are going to have a wonderful time. So, Dr. Manjula, I thank you. And of course, we have Dr. Sudarshan, who is like our master, who will keep a watch on what I do and what Chetan Trivedi does and what Manjula does. And it's very important to have such a eminent person guiding us across this quiz. So let us start the quiz, Dr. Manjula. We are already a little late, so we'll start
Yes,
the quiz.
yes. Computer G, can you start the
Be as a quiz master, because best thing about a quiz master is he doesn't need to prepare for the quiz and he doesn't need to know the answers also. And most importantly, they have two big bosses with in the support. I have two big bosses, so even at all any problem, they are there to help me. But unfortunately, you people don't have anybody to help you out. But I think what will come to your rescue is your knowledge. And I've seen the questions that absolutely they have been very simple, and it requires basic common sense and what you are doing daily, day in and day out. So just go ahead and give the answers, and you will be correct most of the times. So I think let's start with the trial questions, right, Dr. Manjula?
Yes, sir. Yes, sir.
Okay.
First dummy questions. Yeah.
So what exactly I will be doing is, as soon as the question will be flashed on your screen, I'll read out the whole question, and after that I'll say your time starts now. At that time you will be able to lock your answer. So you will get enough time. At the same time, you decide your answer and quick to answer the correct answer. Okay. Chalo, let's play with the three. We have three questions, right? Trial
Yes,
questions.
sir. Three dummy questions
So
for them
friends,
to
there are three
familiarize.
dummy questions. So you have three opportunities to play a trial ball. So let's have first ball rolling. Computer G, can we have the first question on the screen? Okay. So the question number one is, how many colors are there in a rainbow? Your options are A 5, B 7, C 14, and D 6. And your time starts now. So time's up. And I think we'll have some pause in between when we finish the your polling and we get the scoreboard. So there will be few seconds gap which we'll have to this time we will utilize to give you some knowledge about the questions and the options. Suppose in this case, I don't know how I can explain you how many colors are there in rainbow. For that matter, first you have to take yourself out of the hospital. You go out of your hospital, bring your mind and eyes out of your books, go out, see in the rainy season, and you will be able to see the beautiful colors of the light. And that's a rainbow. So we know that there are seven colors in the rainbow, and for that matter, we should have magical eye. So, friends, you have to work very hard when you are in pediatrics or PGs. At the same time, don't forget the nature, because nature is absolutely fantastic outside. So take out your time from your busy schedule and enjoy the nature too. So I think
The
and
right answers.
that right answer is hopefully is the correct is the right answer is B 7. Let's see how many have given the correct answer.
Yeah.
Please share the graph. So this is what we want
Ah,
for all the questions. So 100% people they have given correct answer. Now the trick over is who has given in the shortest time. That's
yeah.
important.
Yeah.
Let's see who is that. Priyanka Babu from Kim's Hubli. Very congratulations, Dr. Priyanka. So I think people are all ready with that. Shall we go for one more question? I think
Yeah.
then we can switch to directly our quiz. We'll give one more question. We'll not waste time in this because these people are very much ready with quiz format. Okay, next question is on your screen. How many seconds are there in 1 hour? A, the 3600, B, 6000, C, 1200, and D, 4800. And your time starts now. Time's up. And the correct answer is, I have to ask the correct answer because everybody in the this field of medicine, very few are like Dr. Sudarshan and Dr. Chinappa who are good at maths also. People like me are very poor at maths, so I have to use a calculator. But nowadays, because A and B group is there, the people who don't like maths, they go for the B group and they go for the medicine option. That's been routine trend. So for you people, this may be a difficult question, and so you all must have used their calculator to answer. So yes, you have to just multiply, and I hope you multiply your income in future. There, you need a calculator. You can't calculate just like that. That's my wish. Uh, Dr. Chinappa sir, am I good with that?
Absolutely. I think that's important. The only other thing is that you can do the calculation from your mobile phone. So I think that's
Okay, let's have the graph. Okay, here there are 86% do give the correct answer. So yes, they are eligible for this field of medicine. Those who are given the incorrect answer. So we can have the leaderboard who has given the first. Meenal Kalra from Kasturba Medical College, Karnataka. Congratulations, Meenal. Okay, now I think computer we can go directly to question number like our actual quiz, so we can save time. Am I good with that, Dr. Manjula?
Maybe I think they have their live. It should go in the sequence. I think. Can we quickly
Okay,
finish the third one, sir?
fine. Okay, go for next
Yeah.
question.
Yes.
This is again a trial question, demo question. Computer please bring the next question on the screen. And here it is. The 5 vowel in English language are A is I O W E W, B is A E S O U, C is A E I O U, and D is A E. What is that option? I.
IEL.
It gets stuck, hidden. Okay, fine. So you can see, and your time starts now.
Okay.
Okay. So this is a language question. Dr. Sudarshan, can you throw light how to remember this?
No, we have learned it as AEIOU.
Yeah.
By heart.
And also, within the fastest finger, what is the time taken? 2 seconds, 1 second, 3 seconds. I think we need to tell that also, so that it will give some guidance to the next round of questions. I think otherwise we are going on the right track, and this time the computer just jumped. We are still.
I know. Please.
Yeah.
Yeah.
Right.
Computer ji, please don't shortcut anything. Please
Yeah.
go first
Yeah.
timer, then the right answer, then the
Yeah.
graph, then the winner. Same sequence,
Okay.
please.
We'll go a bit slow. Thank
Yeah.
you. Thank you.
So we'll start the main quiz, sir. Dr. Chetan, sir, main.
Yeah.
So
Yes.
participants, you can tell them it's before it is starting the main quiz.
So we are not going to show the answers, right?
They did not actually allow them, I think. Do we have the answers? I don't know. The dummy question in any case.
Okay. No. Okay,
They
fine.
don't have it.
Fine. So now we are starting with the real crux. Okay. So participants, are you ready? I hope everybody is ready. With your fingers brushed very clearly, your mobile or your laptop screen are very visible. And here is your first question of the quiz on your screen. Computer G, please. Okay, the question number 1 is, which of the following is true regarding hyperthermia? A. Hyperthermia is unregulated process of increasing body temperature. B. Interleukins do not play a role in the rise of fever. C. The set point of the hypothalamus is not involved. And D. All of the above are true. And your time starts now. time's up. And the correct answer is all of above are true. Now, we know that this is a hyperthermia, and it is because of uncontrolled increase in body temperature. Usually, that exceeds the body's capacity or ability to lose the heat. And that's why it is like the thermoregulatory set point, which is there in hypothalamus, it has not been changed. And in contrast to that fever which is occurring in infection, this has not been caused by pyrogens. It's just an exposure to high temperature, which can lead to hyperthermia or heat stroke. And here, only thing is you have to make an external cooling. Okay, if you delay it, it may result in a hepatic or renal failure, or even DIC, or many times fulminant multi-organ failure can be seen. What are the examples? One is heat stroke. Okay, then you may have some CNS region, central core fever, maybe a hyperthermia which is malignant, or many times drug induced. These are the examples of our hyperthermia. So this was in brief about hyperthermia. Do we have the results?
Yes, sir.
Yes. Okay, we have mixed house. So there are people who are thinking that A, B, and C is also true, but no. Let's see who has given the correct answer in the shortest time. Vidyashri Gundela from Katakia Medical College, Telangana. Many, many congratulations. She took 3 seconds to give the correct answer, but she was among the first who gave the correct answer. Many congratulations, Dr. Vidyashri. Okay, so anyways, there are many, many questions to go. The participants, be ready for the next question. And computer G, let's have another question on the screen. Okay, question number 2 is, which of the following is an acceptable antipyrectic? A, paracetamol only. B, mefenamic acid. C, paracetamol followed by mefenamic acid. D, ibuprofen for fever which is more than 100 degrees Fahrenheit, 103. And E, all of the above are acceptable. And your time starts now. Okay, now let's have the correct answer. Correct answer here is paracetamol only. Now, friends, we know that here, what is the role of antipyretic? We want to make the child comfortable, not that we want to make the temperature which is 102, 103 to make it 98.4. Okay, so this is not at all the aim of this particular antipyretic. So here we need antipyretic which is safest. Okay, so when you talk about say mefenamic acid or nicotinamide, they are not been for the as an antipyretic. And most important myth what we are having is the antibiotic dose. People are saying that because it is a high grade fever, we just give a higher dose of antibiotic, or you choose antibiotic maybe because it is high fever. No, there is no advantage of even a sequential uh, antibiotic. So if you give paracetamol followed by mefenamic, no, only paracetamol which is safe and the most effective. So this is the most acceptable antibiotic. And let's see who has given, how many of you have given the correct answer? Computer G. Okay, so there are people who have given maximum to A and D, but A and D2, that is. But the correct answer is almost 33% people have given the correct answer. Let's see who has given the first correct answer. Again, Vidyashri Gundela, good, from Kakatia Medical College, Telangana. Congratulations, Dr. Vidyashri. Fine. She is very rapid with the picking of the correct answer. Congratulations. Keep it up. Okay, then let's go to the question number 3. Computer Ji, can we have next question on screen? Yes, it is there. Which of the following is not a clinical symptom or a sign of a viral infection, illness? Sorry. A, more than 2 mucous membranes involved. B, dysentery. C, similar cases in all the family members, running nose, coryza, etc. And D, vesicles on hard palate. And your time starts now. So let's have the correct answer. Computer ji. Yes, dysentery is the correct answer. Now, why it is so important for you people to understand this is a viral illness? Because now we have been very much particular about our antibiotic abuse, and we want to have antibiotics towards it. So we should be knowing which are the illnesses which have been caused by the organism which requires antibiotics. And we know that bacteria are the only antibiotics, that organism which require antibiotics. Viral illnesses, they don't require any antibiotic. So when you talk about more than two mucus involvement, yes, it is viral. If you have family members similarly in the family, yes. Vesicles on the heart pellet, again, it's a herpangina. Don't go for antibiotics. This is the self-limiting disease. Maybe enteroviruses are there. Even HFMD can have this kind of vesicles or the ulcers in the heart pellet. But dysentery, we know dysentery is called that there is a blood which is in the stool. When you see a blood in the stool, it is dysentery. And when you have dysentery, the most common organisms we have in India is either E. coli or Shigella. That those two things they require antibiotics. Anyways, let's see what are the percentage of people who have given the correct answer B. Yes, very good, very good, very good. This is good for our antibiotic stewardship program. If you are aware that these are the viral infection, please make a bold, like very bold step. Don't go for antibiotics. Write on the paper, it is a viral infection. I will just give supportive diet treatment. Fine, let's see who has given the first answer correctly. Priyanka Babu, yes, from Kim Subli, Karnataka. Very good, Dr. Priyanka. Keep it up. Anyways, so we all have been roused up now. Let us go for the question. Next question. Computer ji, can we have the next question on the screen? Yes. Question number 4. Which of the following is false? Mind well, false with regards to neonatal fever. All neonatal fevers need to be hospitalized and evaluated. Oral antibiotics are a reasonable option for well-looking newborn with high-grade fever. Neonates have high incidence of serious bacterial infections, and lumbar puncture is mandatory if child has positive blood culture growth. And your time starts now. Time's up, time's up. Let's see which is the correct answer amongst all these four. Yes. Friends, we know that neonates, they have been totally different group of the patients. When we talk about neonatal mortality or neonatal conditions or neonatal choice of treatment for neonatology, because that falls into high risk people. Okay, so we know that whenever there is a fever in neonate, we have to consider it's a serious infection. Why? Because maximum chances of serious bacterial infection going to be there in neonatal fever. So we can't take it lightly. We have to go for a hospitalization. We at least, because even if good looking neonate may be having meningitis, maybe having a later on presentation. So just pick up the opportunity to hospitalize them, evaluate it. You have to go for all investigation. Yes, sepsis screen. And for newborn, CSF is part of sepsis screen. So you need to go for CSF, and particularly if you have blood culture positivity, definitely will need it. But maybe we take time for the blood culture to come. But before that also, if you suspect patient is having a fever infection, we have to go for CSF, and that should be our goal. Oral antibiotics not a reasonable option because the absorption is not at all as expected. And if you have the poor absorption, your antibiotic is not going to work, and patient you may lose the patient. That's the risk because mortality in newborn is very high, and that's why friends never ever indulge into the oral antibiotic, even if a good looking antibiotic, a good looking newborn, that may fool you. Okay, so you just go for the step by step treatment, step by step management. So, computer ji, can we have the polls who have given? Okay, so A and B, we have the audience have rather all the participants are divided between A and B. So let's go for who has given the correct answer. Fastest. Again, we have another winner here. Good to see one more person adding. Kirtana GY, Karnataka Institute of Medical Sciences from Karnataka. She took 4 seconds to decide which is false in this. Congratulations, Dr. Kirtana. Computer ji, we are going good. Let's go for the next question. Question number 5. Participants ready? It's there on your screen. Quiz number 5. Which of the following is true regarding dengue fever? A. There is an approved vaccine for preventing dengue in India. B. Dengue virus is transmitted by Culex species of mosquito. C. Production of IgM starts on day 2 of illness. And 4. NS1 is rapidly cleared in secondary dengue infection. And your time starts now. Time's up, time's up, time's up. Okay. Now, what's correct answer? Computer ji, can we know? Okay. So D is the correct answer because which of the following is true regarding dengue fever has been asked. Okay. So that means other three are not correct. Okay. So let us go by C. C is the production of IgM starts on day 2. No, because any serology will take some time. So from 0 to 5 days, this is a period when you are getting more chances of NS1 positivity. The IgM followed by IgG in primary dengue and IgG followed by IgM in a secondary dengue. That will be the pattern of coming of serology. But we know that serology comes later in the disease process. That's why, Vidal is now been discounted. We are not doing it. It's a serology test. When you do in a day, first week, the Vidal positivity will not be any important. Second thing is dengue virus is not transmitted through mosquito. Okay, and most importantly, the approved vaccine. Now we have been heading towards the vaccine for hunt for dengue, and we know that previously there was vaccine which was available, but that was because of antibody dependent enhancement was not working well. Now we are going to have shortly a dengue vaccine, maybe by some Japanese company, which will be partnering with the Indian company, and this vaccine may come and may see the day of life in India soon. So we know there are 4 types of dengue viruses. We need to cover all 4, and we in India have dengue 2, which is maximum common. Anyways, this was a discussion about dengue. Computer ji, can we have what is the polls? Okay, so majority of you have given the D as a correct option, and let us see who has given the fastest first. Good to see Dr. Shankara D, Karnataka Medical College, getting the answer. He took only a second. He took only a second. That's amazing. That's amazing. Many congratulations, Shankar. You just keep it up because you will be in the race then. Okay, Computer ji, let's go for the question number 6. And participants, be ready. Next question is there on your screen. In which malarial species infection we can detect histidine-rich protein 2 on rapid diagnostic test, that is RDT? A, only falciparum species, B, only vivax, C, both A and B, and D, all 4 species of plasmodium. And your time starts now. Time's up. Let's see which is the correct answer. Okay, so this HRP2 is for only falciparum species. See, these are the RDT, rapid diagnostic tests. They are having a specific thing. Suppose HRP2 for Plasmodium falciparum. We have Aldoles, which is pan-specific. We have LDH. This is maybe for the 5X and falciparum or pan-specific. 3 are available. And what are the advantages of RDT? One, we know that microscopy is a gold standard for diagnostic. But still, because India is a country where we have a periphery where we may not have microscope available, even if the microscope is available, pathology is not available, then this is a simple bedside point of care test, reliable negative predictable value. So this is even with the sequestration, you get positivity. What are the disadvantages? One is it is very less sensitive. Sometimes you may fail because it picks up only up to 100 parasites per microliter, and false positive also is possible, and it can't assess the severity. That is important. And because we know that this particular thing will not give you how severe, they will say yes or no. And once it is positive, it will remain positive for 1 to 5 weeks. So you can't monitor it whether patient has been cleared of that infection or not. So this is the advantage as well as disadvantage of plasmodium. This rapid diagnostic test. So Computer Ji, are we ready with the answers? Okay. So here people have answered differently. All the candidates. Let's see who has given the correct answer. Okay, again, out of majority who are you failed to answer, Dr. Vidyashri made it that she answered correctly, that too in a second. Very good going, Dr. Vidyashri. Keep it up, keep it up. So, Computer Ji, this is going to be a seventh question. Let's go. Friends, question number 7 on your screen. Which is the commonest organism causing UTI, urinary tract infection? A. Proteus mirabilis, B. E. coli, C. Pseudomonas aeruginosa, and D. Shigella sabotisa. And your time starts now. Time's up. Time's up. And the correct answer for this question is E. coli. As I said in GI infection also, dysentery, I said E. coli is commonest bug. Even in UTI, we have E. coli, which is very common. Now, there is a very important discussion that these are the organisms which we are expecting. Suppose you take a urine culture and you get an organism which we are not expecting, then think that it can be some contaminated sample, because the blood culture, urine culture is very, very important. First thing is you can collect the urine by different ways and means. One is you can take definitely a clean catch midstream urine. Okay, that is the most common what we do. You may go for catheterized sample. You may go for suprapubic puncture, but never ever collect the sample of the urine for culture from the urine bag. Okay, mind well, never do that. Clean catch, midstream simple is the most common. You ask the baby to when they are passing urine, put it in the way. It is a very tricky situation. You have to collect it and then you send it to the lab immediately. Don't keep it outside. If there is expected delay to send this particular sample to the lab, then you keep it in refrigerator, because we don't want organisms to grow if you keep it outside. So if you have a sample at the urine and stool, if there is expected delay, you keep it in a refrigerator. But if your sample, which is supposed to be a sterile site, suppose you have CSF culture, you see a blood culture, then you have to keep it in the room temperature so that the organism will grow. So this is very important, that urine stool to be kept in refrigerator. Others you can keep it in room temperature when there is expected delay. Computer, are we ready with the poll? Yes. Good. So what was the correct answer? I just forgot it. Here B was the correct.
Yes, E. coli.
Yes. Sorry, E. coli. I went up into the discussion so much that I forgot the options. Anyway, so great. Everybody knows that E. coli is most common. But what I told, that is more important, because E. coli, the people are going to give you the answer, but how you have to treat, that is what basic understanding is important. So let's see who has given the correct answer amongst all. Fastest. Again, we have one more winner, G. Supraja from GSL Medical College, Andhra Pradesh. Many congratulations. Now people are very fast. Within a second, they are answering. Great. Many congratulations. Keep it up. We're going to have a tough time, maybe, because within 7 days we have 4 or 5 winners. Good. Anyways, Computer Ji, we are almost 1/3 of the things have been over. So now let's go for the question number 8. Friends, the question is on your screen. Which of the following is true regarding Kawasaki disease? A common age of presentation is more than 5 years. Minimum duration of fever is 48 hours. Tender anterior cervical lymphadenopathy is common, and all are false. Your time starts now. Okay, can we have the correct answer? Okay, all are false. Uh, I would need help from Dr. Chinnappa sir and sir, tender anterior cervical lymphadenopathy. So
Yeah.
yes,
So basically the anterior cervical lymphadenopathy typically in Kawasaki is non-tender.
okay, fine, got it.
So
So friends,
basically you will, yeah,
yes. I just wanted to confirm that non-tender only.
yeah, yeah.
So Kawasaki disease is a disease which is of typically less than 5 years of age. One thing you have to remember. Second thing, when you think of Kawasaki, the fever has to be there more than 5 days of duration. Then only you think it. Then it is a disease where you have fever more than 5 days, and there is a lymph node. Typically, it is a localized lymph node, anterior cervical lymph node. It is non-tender. Yes, there will be other features of Kawasaki, like you have injection in the conjunctiva. It's not non-purulent conjunctivitis. Okay, then you have the red tongue. Okay, strawberry tongue. You will have the edema on the both the hands. Okay, and on the feet also. You don't have that sort of typical tender lymph node, but it is a lymph node. Okay, so these are the features of Kawasaki disease. So when you think that it is which is not Kawasaki, that is also important. If you have the purulent conjunctivitis, if you have purulent tonsillitis, if you have vesicular rash, okay, you have multiple lymph nodes. These are typically 100% not Kawasaki. So forget about Kawasaki in these patients. So here the correct answer is all are false. Anything you want to add, Dr. Pachinappa sir?
No, I think the other very important thing is irritability.
Yeah,
Most children with Kawasaki will be very irritable,
yes,
and the
because
fever
of
will not be responsive to the antipyretics. So
very true.
these are two other pointers in Kawasaki.
And this is very important when you are looking at an infant, because infant will be irritable and the fever will not, respond to any antibiotic for any Kawasaki disease. Anyways, computer G, can we have the polls? Okay, so 47% of the people have given the correct answer. Let's see who has given the first correct answer. Again, Vidyashri, leading the tables from Kakatiya Medical College, Telangana. Congratulations, Dr. Vidyashri. Okay, computer G, can we have the next question? Okay, so next question is brucellosis is caused by eating unpasteurized dairy products, eating uncooked meat, eating reboiled noodles, and eating contaminated eggs. And your time starts now. Okay, so your time's up, and let's see which is the correct answer. Yes, brucellosis is been very commonly found as a pyrexia of PO, right? You don't get any clue. You have prolonged fever of unknown origin, and you always get confused what is happening to this child. All the reports are normal. So in that particular case, you suspect brucella, and for that matter, if you have that thing in your mind, you would have asked the history of having unpasteurized dairy product. Now there are people who are in habit of getting that dairy products like a milk from cows or buffalo directly without boiling. So if you have that history, or they have been exposed to this kind of dairy product, then there are chances brucellosis. So brucellosis will be closely mimicking your enteric fever. But only thing is there will be prolonged fever. You will get all reports negative, and then you may get the diagnosis by when you investigate a bone marrow. You go for it, and then you ask them to go for a culture, and you may get as brucella positive. Yeah, there are serology which is available, but the gold standard is you isolate that brucella in the bone marrow. So no, it is not been caused by eating uncooked meat or reboiled noodles or contaminated eggs. Precisely a dairy product which is unpasteurized. So ask all the our patients, they should be instructed that you should be using either a pasteurized milk or whatever milk you get, you first get it boiled and then you use. So then there were less chances of getting brucella. Anyways, computer G, can we have the polls? Is it ready? Okay, fine, great. Okay, so people they know the answer. Let's see who has given it correct answer the fastest. Again, Dr. Shankar. Good. Karnataka Medical College, Karnataka. He took 2 seconds this time. Fine. So we have a good competition going on. I'm sure we are going to have a tie. The way people are coming up as winners. Anyways, Computer G, let's go to the next question. And friends, question number 10 is on your screen. Which of the following samples has the highest rate of picking up AFB via gene expert technique? That is CBNAT. CSF, tissue, ascitic fluid, and pleural fluid. And your time starts now. So, which of the following is the highest rate of picking up? What's the answer, Computer G? Tissue. Tissue is very important, and that's why we always say when you go for suppose a lymph node biopsy, their tissue is better. So if you aspirate and send final aspiration, so FNAC, it is better to have a excision biopsy for that particular thing. Many times we feel that yes, ascitic fluid or pleural fluid. No, this is a reactionary fluid. So you may not get because the positivity is very low for gene expert. So to diagnose it from this ascitic fluid or pleural fluid or a CSF, it's a not good idea. So you need to have the tissue for the diagnosis. And nowadays we know that NTEP has been very clearly mentioning you should have a microbiological diagnosis. So you should be confirming your CBNet, which has been now available all across the country, all nooks and corners. It's been very freely available. You just approach the government machinery, and they will take care of that. Not only that, they will start with the proper treatment. And most importantly, for the practicing pediatrician, now we have option that they take the medicine from the government setup and they come for us for the follow-up with us. So this is what the public-private partnership is working wonderfully for the tuberculosis. Okay, so Computer G, can we have the results? Okay, so people they think that ascitic fluid is also one good option. No, friends, it is only a tissue. So that's what I explained you. Let's see who has given the correct answer fastest. Good, good. Dr. Shweta Sherry, Karnataka Institute of Medical Sciences, Hubli. She took 4 seconds to get the correct answer. Good. We have one more winner. Congratulations, Dr. Shweta. Keep it up. You can still win the race. So
Sir, we are halfway through. Can we
halfway.
see the half how it is looking, sir?
Acha,
50%.
we have that option
10 up.
also.
Yeah,
Good, good.
10. Okay, right, sir. Computer Ji, can you show us how is the result so far? Who is leading?
All the participants have a glass of water.
Yeah, correct. And
And
the
wash your hands.
a quiz master as well.
Wash your hands to make the fingers work very fast.
Yeah.
Okay, fine, fine. Dr. Vidyashree is leading the table with 4 correct answers. Shankar is just behind, and there are 4 people who are chasing these 2 people, Vidyashree and Shankar, Dr. Supraja, Dr. Kirtana, Dr. Priyanka, Dr. Shweta. And most important observation is Shankar is a lone warrior amongst all the females.
Women power.
So I think the boys are playing games very faster. So
No,
now
no, 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 no. I have a comment here. I think more number of ladies are taking pediatrics itself.
okay, that's true. That's true. anyways. So everybody has chance because there are 10 more questions, right?
Yes,
So
sir.
anybody can be winner. Okay,
Yes,
fine.
sir.
Come on, Computer Ji, let's restart our quiz. And next question is which of the following is false about Kikuchi disease? It is a non-necrotizing lymphadenitis. Patients usually present with low CRP. Patients diagnosed with Kikuchi can develop SLE later in life. And removal of tender lymph node is usually therapeutic. And your time starts now. Okay, so time's up. And what's the correct answer? This one is false because, friends, Kikuchi Fujimoto disease. This is a necrotizing lymphadenitis. We remember like that. Okay, so this is a necrotizing lymphadenopathy. Yes, then patient usually present with low CRP because that is a lymph node, but there is no sign of inflammation, infection or inflammation. So you don't get CRP which is high. Patient is diagnosed. This is very important. That suppose you get to diagnose a Kikuchi, mind well, they may go for SLE later in the life. This is very important. And removal of tender lymph node is therapeutic, but many a times masterly inactivity is also fine. But most important thing is about Kichifumoto is the name itself is very, it looks how we came to that name. It was because it was originally described by Dr. Kikuchi and Fujimoto way back in maybe 1970-72. And here it is a lymph node which has been enlarging and there's a painless enlargement of lymph node. So for that matter, you most of the time, rather every time you may suspect it, but ultimately it is a histopathological diagnosis. So you just get excision biopsy, you think of something else, and then you may get surprised with that Kikuchi Fujimoto disease. So that is a pathological diagnosis. Your pathologist must be knowing that this is a sort of necrotizing thing which is coming up, and then that will give you an answer. And that may require steroid many times for treatment, and otherwise it will take its own time to resolve. But most important thing is there will be a chance of SLV later in the line, SLE. So, Computer Ji, that was about Kikuchi. Let's see. Okay, so there's a mixed house again. So, as I said, this is a disease which is not we are very coming across that frequently, but we should be knowing about it. Who is the winner? Let's see. Oh, Vidyashri is not allowing anyone to surpass her. Good, Dr. Vidyashri. Now, so I think people should be aiming at number 2. Anyways, Computer Ji, let's go for the next question. Question number 12. Participants, ready? It's on your screen. The ideal antibiotic of choice for community-acquired pneumonia in a 5-year-old child is amoxicillin, amoxicillin, ceftriaxone, or meropenem. And your time starts now. Time's up. Okay, Computer Ji, which is the correct answer? Now I expect here people to be correct, but I wonder they may be giving amoxicillin the first answer of choice. Let's see. Okay, fine. First, let us discuss this out. Community acquired pneumonia. This is a very common, and we know that now pneumonia is a very important cause of childhood mortality. And for that matter, we are having a very nice the webinar tomorrow. Dr. Jagdish Chinnappa is going to moderate this seminar webinar. It is at 9 p.m. It is organized by Pediatric Infectious Disease Academy, where I am secretary. So we are going to discuss about community-acquired pneumonia and otitis media. So now here, because the organisms, we know that there are only 3 organisms which are in common, and all these 3 organisms can be taken, particularly Staphylococcus pneumoniae. That is the most common cause of this pneumonia. So amoxicillin itself is sufficient. You don't require amoxicillin. Okay, because amoxicillin when you use, you suspect some resistance, otherwise not. Second thing, ceftriaxone. Yes, it is a good choice for community-acquired pneumonia, but if you need to hospitalize them, then you may think about it. Otherwise, no. And meropenem definitely will be working against all these organisms, but that is going to overkill. So, what is the antibiotic stewardship is? You choose the correct antibiotic in a correct dose, and with the narrowest spectrum antibiotic, you try to take care of the infection. And that's why amoxicillin, and that too in India, still we are good with the dose of 40 to 50 milligram per kilogram. We need not to go for high dose 80, 90 milligram, which is mentioned in US or other foreign textbooks. So still we have sensitivity, and amoxicillin is good for community acquired pneumonia. So Computer Ji, can we have the polls? Yes, good, good, good. The people have given the correct answer, maximum number of. That's good. So I think what I feel is this particular audience or all the participants, they have been very well versed with the antibiotic choice. Thank you. Let's see who has given the correct answer. Priyanka Babu, good, good. That you took lead 1 more point ahead. and I think you're matching with the Dr. Shankara. Fine. So, Computer, let's go for the next question. And the question is, as per taxonomy, which of the following belongs to a fungal species? A. Pneumocystis cerevisiae, B. Rickettsial, 3. Nocardia, and D. Listeria. Your time starts now. Time's up. Let's see which is the correct answer. Okay, so we know that there are the organisms which have been more common in immunocompromised hosts. And this fungus, this is very notorious for those patients who are having immunocompromised status. Now, pneumocystis jirovecii is the most common organism now in particularly HIV positive patients. Now, this, you know that now you all must be aware that pneumocystis carinii was the previous name of this particular organism. Now it is jirovecii. Rickettsial disease. This is a, definitely it's a big group of disease, particularly almost in certain part of the country. When you go to Karnataka, you go to lower Maharashtra, you go to Tamil Nadu or Kerala, you get more kind of rickettsial diseases, and this has been very important. But they are not fungi. That's a totally different organisms. Nocardia, again, this is an organism which has been causing the infectious disease in the it is opportunist infection in the immunocompromised condition and listeria. So these all are not fungi, but only fungi which is there is a pneumocystis cerevisiae. So computer G, can we have the polls, because this is more of a bacteriology or okay. So people are knowing this answer. Good. The fungi is pneumocystis cerevisiae. And who has given the correct answer? Bhavya Pedi, very good. We have one more name for Kannur Medical College, Andhra Pradesh. Congratulations, Bhavya. Still, you can make it 7 more questions. You answer all correct and you will be champion. Okay, fine. Computer Ji, let's go for the question number 14. Bhavya took only 1 second. Good. Very good. Very good. And that too a difficult question. Anyways, question number 14, which is the commonest pathogen causing osteomyelitis across all groups, all age groups? Staphylococcus aureus, Streptococcus aureus, Streptococcus pneumoniae, and non-coagulous staphylococci. And your time starts now. Okay, so your time up, and let's see which is the correct answer. Yes, Staphylococcus aureus is the most common organisms, and so when you see the causative organism for osteomyelitis, you may find the some organisms are common in infants, some are common in later age, but when you see overall, the Staphylococcus aureus is having presence as a common organism of causing osteomyelitis in all the age groups. Yes, you may have other organisms, maybe with some history of injury and all that. But we know that Staphylococcus is the most important organism. That's why we try to target these organisms when you're treating osteomyelitis. And we know that osteomyelitis is the disease where you need to go for parenteral antibiotics and you have to continue and complete the course of whatever 3 or 4 weeks, depending on the organism, and you have to treat it properly. Otherwise, this is a very common disease which is misdiagnosis, because osteomyelitis, when it presents to you, maybe it is a late by which we may take time to diagnose, and the treatment also. We should be taking the help of even the pediatric orthopedic surgeon timely if it has been complicated. Otherwise, you have to treat it very precisely and vigorously. So that is about the osteomyelitis, most common organism Staphylococcus aureus. I hope everybody is given the correct answer. Let's see, Computer G. Yes, majority of given the correct answer, and let's see who is the winner this time. I am also very curious to know who is the winner. Deepika Maitre, good. One more winner. Great, from Karnataka Institute of Medical Science. Great. She took 4 seconds, but she is the first and correct. Very good, Deepika. Welcome on board. Still, you have 6 questions. You can also make it. Anyways, computer G. Let's go for the question number 15. And friends, the question is on your screen. What is the name of the focus in the meninges in tubercular meningitis? Goon focus, Ranke focus, Port's focus, and Rich's focus. Your time starts now. Okay, so the time's up. And what is that correct answer, Computer G? Yes, Rich's focus is called for tuberculous meningitis. We have bone focus that we know that it occurs in the chest, and that was initially been given very much importance in the diagnosis of the pulmonary tuberculosis. And POTS, I think we all must be knowing the POTS spine. It has been very commonly said that it is POTS focus. And Rankes, many of you must not have heard that, but it is usually seen in the healed primary pulmonary tuberculosis. And it is a later manifestation of the bone complex. And it is, there is a two complex of that Rankes. One is the bone lesion that has been undergone the calcification, and ipsilateral calcified medical mediastinal lymph node. So that is about Ranke's complex, but what we have over here is a Rich's focus, and that is a typically name which has been given to the tuberculosis, this particular which has been found in the tuberculous meningitis. Now, tuberculous meningitis, again, this is a disease now gradually been coming out after post-COVID. We are now getting more cases of tuberculous meningitis, and that's maybe because of some reason. And here, the diagnosis, we know that there are other diagnoses, but CSF is a very clear-cut giving you a diagnosis of tuberculous meningitis. And we should have a proper treatment for that, because the mortality as well as morbidity is too much for this tuberculous meningitis. So, Computer J, can we have the results? Okay, so people have given the Rankes. What is the correct answer? What was that, Dr. Manjula? I just forgot.
Yes, correct answer.
D is the correct one.
Okay, so D was the correct answer. Maximum people have given the correct answer. So let's go for the who has given the correct answer first. Again, we have one more winner, Dr. Monica Gudagunti from Karnataka Institute of Medical Science, Hubli. Good, welcome on board, Dr. Monica. So people have options and another opportunity to top in the list. Maybe first two will be selected, so you can definitely work hard. Computer Ji, let's go for the next question. Question number 16. Friends, be prepared. The question is right there on your screen now. Which essential micronutrient that depleted through diarrhea and needs replacement? Zinc, magnesium, calcium, or copper and iron? And your time starts now. Okay, so Computer G, can we have the correct answer? A is the correct answer, zinc. It is the essential micronutrient that depleted through diarrhea requires a replacement. Friends, we know that now, we know whatever in pediatric diarrhea cases, they all are viruses. They're viral diarrheas. They don't require any specific antibiotics. What you require is the supportive line of treatment, and where you may have to give the rehydration depending upon the dehydration, whether it is some dehydration or no dehydration. And once it is some dehydration, you just replenish the fluids. But at the same time, this is a micronutrient which we lose, and that's why many times, because it has been lost so much, we supplement with the zinc. So this is the medicine which we prescribe, only medicine we prescribe maybe during and after episode of diarrhea, that we give it daily for almost 14 days, and that is very important part of our treatment. So zinc and ORS, this makes a Jodi number one for the management of diarrheal disease in children. So friends, that's why we had a campaign of diarrheal disease treatment. We have a diarrhea week also, where we highlighted that this Jodi number one has to be kept in mind. Don't give antibiotics, don't do anything else. And most important thing, many people they think that we have to give rest to the bowel because the patient is having diarrhea. No, give them the nutrient, give them the good hygienic food, and don't just keep the empty stomach to get it better. That is a myth. So, Computer G, can we have the so A, zinc was correct, and everybody given the correct answer. Now let's see who has given in a second, because this is a very simple question. Dr. Jyoti M, she took 1 second. KIMS Medical College, Karnataka. I think Jyoti is new entrant, if I'm not wrong.
Yes, sir. Yes, sir.
Good, good, good. That people are coming up. So fine. Let's go to the next question. Kamraji. Next question is there on your screen. Which of the following is not an immunocompromised condition? Recurrent multilobar pneumonia more than 3 episodes, single episode of meningitis with pneumococcus, recurrent UTI more than 3 episodes, single episode of pneumocystis pneumonia. That is D. And your time starts now. Okay, so let's see which is the correct answer. Recurrent urinary tract infections more than 3 times, it's not the correct answer. Right? This is a very simple question, because we know that we suspect immunocompromised conditions when this kind we have pneumonias, multiple, even a tonsillitis frequent episodes, or you get recurrent pneumonias, or you have a meningitis because even a pneumococcus, because normally an immunocompetent patient may not have this sort of meningitis and pneumococcus. So we have to suspect even a liver abscess. Nowadays we think the liver abscess in an immunocompetent patient is not possible. So to suspect unusual organism, unduly prolonged treatment, your routine antibiotics not working, whenever you think there's that kind of thing, you suspect it is immunocompromised condition. And even a single episode of fungal pneumonia, definitely it is not an immunocompetent host. So, sorry. So this is what option C. It is not an immunocompromised condition. UTI can happen. Yeah, there can be different reasons for that, but not immunocompromised. Computer, and can we have the polls? Sorry. So we have people who have chosen for B and D maximum. Now let's see, because it's a UTI. UTI doesn't happen in immunocompromised condition. It is not directing us to even immunocompetent host can happen. There can be different results. We said VUR. So again, Dr. Shankara timely pitched in, and he is now going to be saying that yes, I'm going to stay there at least in the lead for second spot. Fine. Let's go for the next question. What is the duration of treatment for CSF culture proven gram-negative uncomplicated meningitis? Okay. So here options are 7 days, 10 days, 14 days, and 21 days, and your time starts now. Okay, let's see what is the correct answer. 21 days. Mind well, friends. Here, what the question is, duration of treatment for CSF culture proven gram-negative uncomplicated meningitis. We know that when there is a complicated meningitis or uncomplicated meningitis, we have a recommendation. Usually, if you have a streptococcus pneumonia, right? If it is uncomplicated, then it can be 10 to 14 days you can give the antibiotics IV. If you have Hib, suppose as an organism, then 7 to 10 days. And suppose you have Neisseria meningitis, so meningococcal meningitis, then it will be 5 to 7 days. But when you have a gram-negative gram-negative organisms, then you need to give it for prolonged period of time. So maybe 21 days, and that's the correct answer, not even 14. So because the complications are going to be more, and we want to cure it 100%, and because meningitis as such, it has been associated with morbidity and mortality, so we need to take care of giving a correct dose in correct duration also. So here the answer is gram-negative uncomplicated meningitis. 21 days are required. Let's see how many of you have given the correct answers. Yes, majority of you have chosen the first correct answer, that is 64%. Now let's see who is the winner. Oh, good to see one more winner coming up. Dr. Neha S. from Karnataka Medical College. I think all are coming from the same medical college. They are fighting in between, or they have been sitting together and giving chance to others to come up. I'm just joking. Anyways, she took 4 seconds to answer. And Computer G, we can just go to the 19th question. So we are now heading towards the end of the quiz. 19th question. Which set of infections are common in children with asplenia? Pneumococcal and meningococcal infection, meningococcal and H. immunophilus, salmonella and meningococcal, and all of above. And your time starts now. Okay, let's see which is the correct answer. All of above. And why this is important? Because spleen is a very important organ in our body. So when we don't have the, either it is been removed surgically or it is non-functional, functional asplenia is there, we have sickle cell and we have to remove it. Then in that case, we know that the organisms are very specific. Okay, encapsulated organisms are very common infections in case of asplenia. So why this important as a pediatrician? Because your surgeon will call you, or you have a situation with medical condition that we know that functional asplenia is there. There you have to decide before going in for surgery or patient is having asplenia, which particular vaccines to be given. So we need to cover the vaccinations where these organisms are going to be common. So you'll give pneumococcal vaccine, you'll give meningococcal vaccine, you'll give Hib vaccine, and even if you give flu also and salmonella. So these all organisms need to be covered, and for that matter, you have to give vaccine, and vaccine you have to start it and finish it before 15 days of surgery. And suppose it has been emergency surgery, then after 15 days you have to finish up all the vaccine possible. And for meningococcal and pneumococcal vaccine, you can give it on the same day, except for certain brands, but that is beyond the discussion of this particular topic. But we should be knowing that they are at risk of this encapsulated organisms. So, Computer G, can we have the polls ready? Yes. Okay. So, maximum number of people have chosen the D. That is all. So that's correct. And let's see who is the winner. Okay, one more. And Dr. Kamalavani Somasundaram from Stanley Medical College, Tamil Nadu. Good for Tamil Nadu. There is one more winner. So congratulations, Dr. Kamalavani. You took only 1 second. Where were you till now? Anyways, so now we have only one question left, and let's see what happens, because I think we have 2 clear winners. So let's see what happens. Computer, let's have the last question of the quiz. Friends, it's there on the screen. Which antitubercular agent is most hepatotoxic? Isoniazid, rifampicin, pyrazinamide, and ethambutol. And your time starts now. Okay, so time's up, and let's see which is the correct answer. Most hepatotoxic. Now, this has been asked. We know that when you have the antitubercular treatment, we have isoniazid, rifampicin, pyrazinamide. All three are been hepatotoxic drugs, and out of that, the most hepatotoxic is pyrazinamide, because once you have the toxicity of pyrazinamide, suppose you have started the treatment and your SGPT is going out high and you have vomiting and all that. If you think that it is because of this and it is hepatotoxicity, we should never ever restart pyrazinamide. So there is a specific protocol how to manage with this complication of hepatotoxicity of antitubercular treatment. But yes, ethambutol is not having hepatotoxicity, so you can definitely continue. And even streptomycin, it is not a hepatotoxic, but there is a different regime, maybe 15 days or 1 month. You get the chances of getting this toxicity. So keep in mind, if child is having vomiting, try to see the sclera. If not, get a SGPT done and look at it. If it is going 3 to 5 times higher, then it is a hepatotoxicity. So, Computer G, can we have the polls? Okay, so people are confused. But one thing is sure that everybody knows that ethambutol is not hepatotoxic drug. That's good. But yes, because it is question is like which is the most. So you should be knowing pyrazinamide because it is very important. You should not use it pyrazinamide once it has been found to be culprit. So let's see who is the winner. Deepika Maitre, good. Karnataka Institute of Medical Science from Karnataka took only 1 second. Fantastic performance, all the participants. Wonderful. You have so many winners, and that shows that everybody were very much updated with the knowledge and all this quiz. So this is really a success of the quiz. So Dr. Manjula, I think we are at end of this quiz.
Yes,
And
sir.
good part of the story is we have many winners. So
I know, sir.
maybe the first, second, whosoever has been there is good, but at least 5, 6, or 7 people are answering any one or other question first to getting the winner position. So I think they will prepare the list and
Please stand show us, sir, in moment. Jagdish,
yeah,
sir, meanwhile, you would like to say anything,
yeah.
sir?
Sir is
Yeah,
traveling.
I think, yeah. Actually, I am traveling. So the quiz was fantastically conducted. Congratulations, Dr. Chetan,
Thank you,
because
sir.
you had educated them also about a lot of things which are very very important for postgraduates to know. And I'm also very happy with the answers given by most of them. They've given the right answers. Maybe some of them missed out on the timing, but overall the performance has been exceedingly good. And today I must also congratulate the technical team. They were spot on and did not have any issues. So I think it's important that always be a quizmaster on the second day, not on the first day. So, so thank you very much. And I'm sure Dr. Sudarshan
Yes.
will now guide us as to how to make this even better on the third day.
Sir, Sudarshan, sir, over to you, sir.
Yeah. No, nothing. I had to shift because of some reason. So that's why there's no light on my face. So otherwise, everything went on well. It was very conducted on a fast track, and we have completed, I think, well ahead of time. I think we'll silently wait for the result. Over and back to Dr. Manjula. Thank you, everyone. Thank you.
Chetan, sir, you would like to say yes, sir.
So Chinnappa sir, it is always good to be not to be on first day, but at the same time you may get surprised that you have been thinking that you are coming on third day and you are getting it on second day.
Sometimes it is good to read WhatsApp messages.
I now I realize she has given me 24th July, everything is there. And then I was thinking West Zone I am, because I thought I am going to manage West Zone. So that was the real problem. But anyway, it's good to be caught red-handed or rather unprepared. So good for me
Result is
also.
ready.
I
Result is
tested my
ready.
knowledge also.
Okay.
Yeah,
Sir,
so result is ready. Good.
Can you show, please? Yeah.
Yes. Okay. So we have clear winners, but I would like
Yeah.
to start from bottom. We
Yes,
have
sir.
winners. We have winners who have not been seen in the screen. First thing is, we have winners who have participated in this quiz. They updated their knowledge. Yes, they couldn't make it in first 2 or 3 seconds. Maybe there may be another problems also. Maybe some connectivity net issue. We don't know. But still, if you have participated, you are definitely a winner. We have winner Dr. Shweta Sherry, Dr. Neha S, Dr. Monica, Dr. Kirtana, Dr. Kamala Mani, Dr. Jyoti, Dr. Supraja, Dr. Bhavya, Dr. Priyanka, Dr. Deepika. But for today's, as for a selection purpose, we have two winners. They are outright winners, Dr. Vidyashree and Dr. Shankar. Vidyashree with the highest correct point, that is 5. Congratulations, Dr. Vidyashree and Dr. Shankara. You also made it in time. Otherwise, if you have missed on one question, you would have been in amongst rows 3 for the tie. So many congratulations, Team Telangana, uh, Kakatiya Medical College, and Karnataka Medical College. Good to see Telangana and Karnataka states. They have been dividing these prizes, first and second. You are most welcome to our most prestigious event of Fever Foundation. There's FEFCON, which is going to be there maybe in the month of November, and you have been personally called, and we'll have the final round of quiz. Thank you so much, Dr. Manjula.
Thank you very much, sir. Congratulations to the winner. And both of you, Dr. Vidya and Dr. Shankar, our Fever Foundation team will contact you and tell you about other things, finals, etc. Finals will be in November, so you will be competing for the national championship. And all the other participants, congratulations for playing. And also, you will all be getting the participation certificate as well from Fever Foundation. And all of you, please, if you have a research activity which you want to present and give it as a poster presentation, especially the activities on fever, it may be interesting case or it could be original present research, please submit your posters on or before September 12th. September 10th. So that's the last day, and it will be intimated to you all at all your colleges, at your notice boards, etc. So congratulations to all. Sir, Dr. Jagdish sir, Chetan sir, and Sudarshan sir, with your permission, can we close this event, sir?
Yes, madam.
Yes, madam. Thank you. And
Thank you.
we'll leave.
Thank you, Dr. Chinappa and Dr. Sudarshan, for being there.
So
Yeah,
take this,
thank
yeah,
you,
all
thank you.
the, yeah, I have
Thank
to
you.
thank
Thank you,
uh,
sir. Thank you.
host Dr. Jagdish sir and Chetan
Yeah,
sir for Quizmaster, and our jury for helping us to this, and our entire marketing team of Microlabs, and technical team and the digital team, Deepika. So thank you all. It was wonderful. So we'll
Yeah.
all of us will meet at again 7 o'clock. Not the pediatrician, and sir will be there jury at 7. So for
thank
the
you.
physician quiz. Thank you, sir.
Yeah.
Namaste,
Thank you,
sir.
Thank you.
Dr.
Thank you.
Mr.
Thank
Praveen
you.
Singh,
Thank
and thank you, RX Event.
Again.
you, sir.
They have
Thank you.
been
Thank you. Thank
based
you.
at Ahmedabad, so
Thank
we have a
you.
good
Thank you.
evening.
Thank you. Thank you. Thank you.
Yes, sir. It's
Bye.
hosted from
Bye.
your city, sir.
Yes, yes.